Hi, welcome once again to Senior Focus. I'm your host, Bill Adams. Senior Focus is a show designed for folks over the age of about 50. We bring you information about resources in our area in Mahoning County that hopefully you can use in your daily life. Of course, if you're under 50, you may know relatives who are 50 plus, 60, 70, in their 80s, 90s, who could really benefit from the information that we share on the program. Before we get started, I want to thank Greg Roten from Armstrong's Channel 20 and 100. And again, he produces the show and makes sure that it gets out to you. If you happen to miss any of the show, you could see on demand, you could see the whole show on Armstrong. Also, we eventually get up on YouTube, so you can just put in Armstrong Cable and Senior Focus. Also wanted to let you know that we have a page on Facebook. If you go to facebook.com and Senior Focus TV, and you could see information about the show there. Today we're going to be talking with and interviewing Dorothy Barto and Kathy Fynes. Thanks for coming.
Glad to be here.
And they're both from the Alzheimer's Network here in Mahoning County, which is actually county-wide, but it's actually beyond Mahoning County too, right?
Actually, we are beyond. We are 4 counties. We're from Trumbull, Mahoning, Columbiana, and Mercer County over in PA.
Okay. And we're going to give out the contact information, I guess right now maybe a phone number, but we'll put this out a couple times during the show. If people are interested in following up after today's show, where can they get a hold of you?
Well, we have an office in Boardman, and the phone number is 330-788-9755. And there is someone there to answer your questions, talk about what you need to know, and maybe offer some guidance.
Mm-hmm. And again, Kathy is a board member, and Dorothy, you've been a board member, founder sort of the organization, would you say?
I usually say for 800 years, yes.
Well, and obviously you've worked in the field for a number of years, and so that's why we're here, is to let people know that this resource is out there. We're going to talk about, I guess, some of the things that caregivers should take into account, or what it's like to be a caregiver, what some of the resources are out there. And we were just talking a little bit before the show, but I mentioned that in my own job in a separate healthcare area, I got a call from a lady who has been a caregiver for quite a while, and she seemed very stressed out over the phone. So when someone calls you who is a caregiver and they're working with a loved one at home, what are some of the things you ask them or you talk about with them on an initial call?
Well, if they are really stressed out, one of the first things that we do is to try to calm them down a bit and find out just where they're coming from, what their situation is. Sometimes people jump to a conclusion and they'll think, Dad forgot such and such, he's got Alzheimer's. And you can't make a judgment like that. There's more to it. And one of the first things they need to do is to let the doctor know those things are going on and get that person to a doctor. It could be something else, and it could be something treatable. And that's one reason we say, find out what it is. You can't deal with it till you know what it is. Mm-hmm. So focus on, first of all, finding out what's the problem, and then sometimes it's not that type of an approach. Everybody's different, and everybody's situation is different. Someone else might call in and say, there's nothing wrong with him. Well, yes, he did wreck the car a little bit, and yes, he did get lost, and there's more to it, but with that caregiver, there's more denial than jumping to the conclusion that this is Alzheimer's. So you have to find out where they're coming from, and then boil it down a little bit more to what they need to know. Mm-hmm. So it's a process. I had a call yesterday, which was well over an hour, first to calm the person down and then to find out just where they were coming from and what they needed to do to stabilize their situation for both the caregiver and the patient.
Mm-hmm. Now you have a number of resources, and I'm just looking at your newsletter, which you send out. This is monthly?
Quarterly.
Quarterly, I'm sorry. So you have a quarterly newsletter, and I know one of the things that's involved on the back, you have the listing of caregiver support groups. Is that one of the major functions, I guess? Either one of you, Kathy, you want to talk about?
Yeah, Kathy has helped us out with support groups.
I've helped out with some of them. Usually Dorothy handles the support groups. But this is where people can come to find out answers, give them suggestions as far as what can I do with them, what do I do next. It's a lot of one-to-one, and it's a good resource for these people.
And there is strength in numbers. When there's somebody else that's in the same boat as you are, it's somehow reassuring that they're living through it. You know, I can get through this, or they did such and such. Well, maybe my husband would like to attend a day program too.
A lot of the people share what they've done, what's worked for their loved ones, and it's just a good group. They bond. They do.
Sure. Now, we were talking, Kathy, before the show, and your background is actually as a social worker? Is that correct?
Yes, I worked in long-term care for 20-some years. So I've seen a lot of Alzheimer's, and this is how Dorothy and I became acquainted.
Through your work in the field with, you were at Meridian Arms?
I was at Meridian Arms.
Okay. And Dorothy, you work quite a bit, I guess, with local, with facilities in the area. I know one, well, go ahead.
All different kinds of facilities and programs. I mean, it could be the Area Agency on Aging, and explaining to people, say a caller, as to what programs they have and whether they would qualify for them, or whether they're borderline and should maybe make a call and find out if they would qualify. And it goes from there to helping people find an adult day program. Unless you need an adult day program, you probably don't even know they exist, let alone know where they are, or what's convenient for you, or what might have scholarships, or what might be subsidized by the Veterans Administration. There's so many different areas where we can point people, because being a caregiver, you're under stress, first of all, mentally, but you're also under physical stress because you're living for two people. You're doing household things that maybe your spouse had done before. So we try to, blaze that trail for the person so they don't have so much that they have to invent the wheel.
Right.
But it could be the adult day program, it could be a special unit in an assisted living, it could be nursing care, it could be in-home care. There's so many different things that trying to tailor something that will suit the family.
Now, I know it used to be the case, and that's why I'm asking, is if it's still the case that most people who have been diagnosed with Alzheimer's are being cared for in the community.
A good 70%, yes.
Okay. So there are a lot of people out there, and probably many people who are watching, who either are caregivers themselves or know someone in their family who is. When you have like a family, where maybe there's one person here in town and they're kind of spread out all over the place, do you work with multiple family members sometimes to try to get a team approach, I guess?
We actually do try to get everybody on the same page, because a lot of parents don't really want to ask their kids for help. And sometimes the best thing in a situation where there are children, especially if they're in the area here, reasonably in the area, is to set up a family meeting, or even if they go to one of the support groups. Because sometimes something will come out in a support group, even from another family, that will clue them into, oh, that's why mom doesn't go to church anymore. I thought she was mad at the people at church. No, it's that she can't take dad because it could be an awkward situation or difficult, or other things that have entered into the picture that she can't take him out of the house.
Well, as part of the current newsletter that I was looking at recently here, you have seminars that come along from time to time. I know you just had one on legal and financial matters, but that's information you'll share again with family members, with caregivers?
Right. We have handouts, things that we mail out to folks when they make that initial phone call. We'll make up a packet of things that pertain to what our discussion focused on, and then go from there. Suggest to them there is a legal and financial seminar. We have one in the spring and one in the fall. And try to get them to hear what an attorney has to say about powers of attorney, living wills, what Medicaid is all about. The rules are very complex.
Sure.
And nobody's going to understand all of it from the initial hearing the word Medicaid. It is very complex, and people aren't ready to hear all of that. It's a process. People will go to the spring legal and financial seminar presented by one attorney and go to the fall one by another, and maybe get another, a deeper understanding of it, or maybe a little different drift than they'd had before, as to what pertains to their situation. Because every family has their own financial situation.
What are some of the, again, we were talking before the show about like the family caregiver support through the Agency on Aging. Could you talk a little bit about what that program is?
I'll back up a little bit there so that we'll get a broader picture of the Alzheimer Network's program, which is, we have a caregiver series that's 3 sessions. At the most, they're 2 hours each. But we guide people through the symptoms, diagnosis, behavior, medications, all of what I call the nurse stuff. We have a nurse that presents that session. And then we go into the second session being a little bit on the legal and financial, not as much as what the attorneys get into. But then we also go through the different services in the community. Like, yes, there are adult day programs. Yes, there is an area agency on aging that has the passport program. They also have the family caregiver support program, which isn't quite as rigid. The requirements are a little bit broader than what it is for passport. So sometimes the family will qualify for that, and it can give them some help at home. It can pay for a day program. And a lot of people don't realize the benefits of the Veterans Administration.
Yeah, I'm glad you brought that up. Yeah.
They have some really good subsidies for placement in a residential facility and for adult day programs and some in-home services too. So we try to guide people through that, through some of the safety issues, like having a medic alert bracelet, having the little transponder on the around the person's neck or on their wrist that, if they fall, it changes the position of that little gizmo, and as that changes, if they don't answer or respond to it in 30 seconds, someone is dispatched from emergency services to make sure that person is okay. And that is just as important for the caregiver, because what if the person with Alzheimer's is not able to call or doesn't even realize that their caregiver has had a problem?
Right. Well, and I don't know, Kathy, maybe you can talk about this. There are going to be many people, though, who at a certain point will have to go to a facility of some type. Are there some things that, again, maybe the Alzheimer's Network could share with people in terms of choosing facilities, or what they should look for when you go to look for assisted living or a nursing facility?
Well, I would suggest that they would look for a facility that maybe specializes, that does have a unit, because those staff are trained to work with people who have Alzheimer's, which it works differently with them as opposed to a regular nursing home resident. To make sure they're Medicare, Medicaid certified. And it doesn't hurt to check out their surveys on the internet, to go to,
www.medicare.gov.
Medicare.gov, right?
Yeah. I've been out for 3 years now, so I've forgotten.
That's okay.
And there is a section in there called Nursing Home Compare.
Right, and it will compare them as far as the quality of service that they provide, those different things. So those are the things they really need to look for. And I think when you walk into a facility, you get a feel. And word of mouth, people who've maybe had a resident there or know of somebody. Talk to as many people as you can, and including their physicians. because a lot of the physicians do follow their patients and can give them some insight that way.
Sure. Well, and as a board member, it's a good point, again, so we stress that the Alzheimer's Network is basically totally run by volunteers, correct?
We are all volunteers. We have about 50 volunteers that do different jobs at different times, but they're wonderful folks.
Well, and I want to make sure, and we'll mention this again later in the show, that we do mention about your program and about the Alzheimer's Network. Again, that you have some events coming up. There's one at the end of May.
At the end of May.
You want to talk about that?
We will be walking.
Okay.
The site for our walk will be the Canfield Fairgrounds. It will be May 31st. And it's called Walking Together. And we called it that for two reasons. You might have a patient with Alzheimer's, but they also have a caregiver, so they are together.
Okay.
But you also have the Alzheimer Network there to help both the caregiver and indirectly the patient. So the Alzheimer Network walks together with folks too. So that's the idea behind the Walking Together name. And Kathy's helping out with that, so you want to...
Sure. Our walk is May 31st, which is Saturday, the last Saturday of May. The official registration opens at 8:30 in the morning. The walk, sorry. The walk itself actually starts at 9 o'clock.
Okay.
We will have a 50-50 raffle. We will have a Chinese auction. We do have goodies for the walkers to start off their day with muffins, coffee, those kinds of things for them. We also are going to have a canteen afterwards where they can purchase lunch if they would choose so. We have some other things, irons in the fire, and I just need a little bit more confirmation on them, so there'll be surprises there.
Okay.
And we have a great fellowship. It's just a good time.
And I was going to say, and the, you know, not only does it publicize or let people know that there are many people in this together, you know, walking together, but it's a fundraiser, correct?
Yes.
I mean, for your program.
Yes, it is.
And again, this is for an all-volunteer program. The money would go towards program
Right, there's no
costs.
high salaries paid to anyone.
Right.
We put most of our funding that we use for families into the newsletter. We've got, so many different topical brochures. All of the printing, the postage to send things out, the phone bill, there's overhead with an organization. Even when you're volunteer, it takes some dollars to run it.
And again, we'll talk about this maybe at the end, we'll remind folks, but if folks are interested in contributing, I mean, they would just contact the 330-788-9755, is that correct?
That's right.
But you were also, you take donations year-round from...
And no donation is too small.
And well, one of the things I noticed on the newsletter, many people will make a donation in memory of a loved one.
In fact, some people are walking at the walk in memory of their person. We have stickers that people can put on their back, walking in memory of Dad or Charles or whatever their choice is.
Well, one of the very interesting things, again, just going off the newsletter, was the communication that's needed, or some of the skills to communicate with someone with Alzheimer's. You know, as the disease progresses, people lose their language abilities. And do you just want to take a minute or two to talk about some of those issues of how do you communicate with somebody?
Well, going back to what Kathy said too about special units, it's very difficult to communicate with an Alzheimer patient. For them to understand or for them to be able to make themselves understood. And that's why special units are very important. But we have one brochure that is called Interacting with the Alzheimer Patient, because it is different. The person that the family may have known for kids their whole life is not that same person anymore. And it can be very difficult to realize that now you have to speak slowly, you have to use basic, simple words. You want to get front and center right in front of the person so they can concentrate. And the communication changes as the disease progresses. Now, Alzheimer's can last easily 20 years if someone is healthy. So you have maybe someone who can communicate in the early stages, and as time goes on, maybe their own sentences shorten up, and maybe it's, I want, and they can't even, they know what they want. You can see it in their face that they know what they want, but they can't choose the word because that brain is not functioning as it used to.
Right. And in the newsletter, it talked about sometimes focusing on one word, or, you use the example of milk, and maybe that's the word that keeps coming up. And as a caregiver, the caregiver sort of has to guess maybe as to, well, it's not really milk, but maybe they're thirsty, or maybe it's hungry, or something. And you could just sort of tell by the maybe demeanor of the person when you've struck on the right actual word.
And it can be so disjointed sometimes. There was one lady that said to her husband, he came home from the store, and she said, "Did you put the hat in the oven?" Hat, oven. She meant, "Did you put the car in the garage?" It made totally no sense, but he took it apart a little bit, that's putting something inside of something. And so he asked her, did I put the car in the garage? She said, yes. You can tell by their facial expression sometimes if you hit on what they really want to communicate.
Right. Another interesting thing was about how people will revert maybe sometimes to their native language.
Oh, yeah.
And the example of maybe somebody who spoke Hungarian when they were a youth. And so maybe just sometimes learning a few words in that native language will help.
Definitely.
As the disease progresses there.
And we've even suggested that for some of the day programs, even for some of the nursing facilities, that's the best way to communicate with them, because patients generally go back in time, and if that was their first language, even just single words will creep in. And all right, they're getting further back.
Now again, we have many different support groups in the area. And these are all free, correct?
Absolutely.
Okay. What would somebody do if they want to start at a support group? What do they have to do? Just call you?
They don't even have to call.
They can walk in the door.
They can walk in the door.
They don't have to pre-register or anything?
No, and we understand when somebody comes in late, and nobody worries about that because caregivers can't always keep a really strict schedule, or somebody has to leave early. We understand that because we've all been in that same boat, and we get the picture.
I think another thing that develops from the support group, if there's somebody who comes on a regular basis and they don't show up, and say they don't call the office to let Dorothy know they may not be there, then we might know to go to have somebody check. Maybe something happened. Maybe the patient themselves is in the hospital. Maybe the caregiver herself is in the hospital.
Right.
So that's why I'm saying it's so important to have those relationships.
The support group itself is its own little network within the Alzheimer network.
Right. And again, they're located in Austintown, Boardman, Campbell, Canfield, all throughout Mahoning County, and as you were saying, Trumbull County?
Columbiana.
Columbiana, and now you're also over in Pennsylvania.
That's right, and we have a support group that meets in Greenville.
Okay.
And actually, we call them, as far as the schedule goes, morning, noon, and night, because we have one support group that meets morning, one that meets in the afternoon, and then many of them in the evening, because sometimes that's when a caregiver can get one of their kids to come and sit with dad, or somebody will take mom out to dinner and he can go to the support group then.
So these support groups are available. Again, just call, and your number, and we'll make sure you have that, is 788-9755. And somebody's there to answer it during the day?
We try to. Sometimes the line gets pretty busy, and particularly on Mondays, and we may have to return a call or two. But there is the option of leaving a message, yes.
Okay.
They are listed in the Vindicator.
Oh, the support groups?
Yes, they're published in the Vindicator. They're also on Facebook.
Oh, good, okay.
So
There.
The generation, that uses Facebook, all of us at some point, they're listed there.
Okay, so it would be the Alzheimer's Network is a page on Facebook.
They need to look for
Right.
Alzheimer's Network of Youngstown.
Of Youngstown. Well, and again, we have an event coming up at the end of May, and you want to go through some of the, again, the details of that.
What goes on? Well, we will, in fact, we've already gotten a few registrations and some sponsorships for some healthcare organizations. We're really glad to get a good start like that. And like I say, some people maybe aren't able to walk the tremendous 1 mile, and we have a half-mile cheater course that we don't talk a lot about. But if you feel you can't make it for the whole mile, there's the half mile. And if you want to sit in the Colonial Inn at the fairgrounds and just chat, that's fine too.
Sure.
One of the things that we do with some of the proceeds, which we really haven't gotten into, is that we do support research.
Okay.
We particularly support research in Pittsburgh and Cleveland because those centers, they're both Alzheimer research centers, tend to serve the families in this area. I wish we had a whole lot of geriatric doctors available in this community because we have so many older folks.
Right.
But if they're going to get into research, it's going to be probably at one of those sites.
Well, speaking of geriatric physicians, I know Dr. Wilkins he's still in this area.
Yes.
But we could use more of him, right?
We certainly could.
A few more.
Right.
And if a family is comfortable with their family doctor and they need a consultation, sometimes that can be worked out.
Well, let's just mention another, coming up in the summer, you're going to have the garage sale.
Yes.
And just talk a minute or two about
We
that.
tend to both laugh, but we call it the horrific garage sale. We will be taking things in at Western Reserve United Methodist Church.
Okay.
That's in Canfield Township, beginning the last week in July. Now, that's a split week. Part of it rolls into August. So we will take things in the July part of that week, and then the sale will be in the August part of that week. We can take a few things early, but not a whole lot. Our storage is limited, but people can call the office if they want to make some arrangements. We'll see what we can do.
So that's a major fundraiser for you, again, in late
is.
July, early August. And one last thing, you have also a charity auction, right, coming up in the fall?
That will be in the fall, yes. We call it Valley Memories. And it's usually well-attended. It takes place out at Avion on the Water in Canfield Township.
Okay. We have a minute or so to go. Is there anything that we haven't covered that you wanted to mention or just reiterate about, again, the Alzheimer's Network?
Well, I think one thing that I would like to point out to folks is that the symptoms of the disease creep in so early that the little changes in the person should be reported to the doctor.
Okay.
Because, again, what we started to talk about, you can't deal with the problem till you know what it is. There are some medications that can slow it down, and you want the best quality of life for that person as you could possibly get.
Okay. Well, again, Kathy and Dorothy, we want to thank you both for coming in. Kathy Fynes and Dorothy Barto are with the Alzheimer's Network here in Mahoning County, and also, in the adjoining counties. They'll help you with support groups and answer your questions at 330-788-9755. Thanks for coming in.
Thank you, Bill.
And you've been watching I'm Bill Adams, but you've been watching Senior Focus on Armstrong's Channel 20 and 100. Thank you to Greg Roten from Armstrong Cable. Also, we want to thank Keith Kaiser, who allows us to use the beautiful Davis Visitor Center at Mill Creek Metro Parks. Please come out and enjoy the Metro Park at any time of the year. And I want to thank you especially for watching. And until next time, we'll see you again.